Hello friends, I'm your doctor. Today we are going to see about succinylcholine part 2. So in this part we are going to see in detail about the phase 2 block. Phase 2 block usually occurs in repeated doses of succinylcholine. So the usual dose of succinylcholine is 1 to 1.5 mg per kg. But when the dose exceeds 4 to 8 mg per kg, there will be prolonged stimulation which results in the non-depolarizing block, and there will be fade in train of 4. So when we are giving more doses more frequently or while using continuous infusion, the patient may go for a prolonged blockade which mimics that of a non-depolarizing block. So the treatment is mainly prevention. Give the dose below 4 mg per kg. The treatment for phase 2 block is mechanical ventilation. Ventilate the patient adequately till the effect of the drug wanes off. Give fresh blood which contains pseudocholinesterase which can counteract succinylcholine and which can give you better reversal. Some literature says the use of acetylcholinesterase inhibitors like neostigmine, but its use is controversial. Mainstay is mechanical ventilation and fresh blood. So uses of succinylcholine is mainly used for rapid sequence intubation. So in emergency situations, when the patient is in full stomach and we want to avoid aspiration, we should give succinylcholine for intubation and perform Selleck's maneuver. So it's very useful in emergency intubation. And succinylcholine is useful in electroconvulsive therapy in patients with anticipated difficult airway. So when we are seeing the patients with short neck, retronathia, difficulty in mouth opening, and large tongue, Mallampati grade 3 and 4, in these patients we should use succinylcholine, because if you use non-depolarizing relaxants like atracurium or cisatracurium, the block will be prolonged up to 20 to 30 minutes. Up to that time, if we can't intubate the patient, we should ventilate the patient. So it will be very difficult. The patient may go for hypoxia. So in these situations of difficult airway, we should give only succinylcholine. So the duration of action is limited up to 5 to 6 minutes. The patient automatically will come to spontaneous respiration. And special situations like laryngospasm. So in laryngospasm, there will be tight adduction of the vocal cords. So there will not be any air movement. So in this situation, to break the spasm, the main treatment is succinylcholine. So when the patient goes for laryngospasm, we should break the spasm. So it's done using succinylcholine. And please like and subscribe my channel. Thank you. So these are some of the special situations I have added. In burns, avoid succinylcholine in burns from 48 hours to 1 year. So up to 48 hours, or if you want to be very safe, give up to only 24 hours. Then stop giving succinylcholine up to 1 year. So after 1 to 1 year, we can give succinylcholine. So because it will cause severe hyperkalemia due to the proliferation of extrajunctional receptors. The extrajunctional receptors has a tendency to release more potassium into the circulation because it's open for a very long time. So it will release more potassium and causing hyperkalemia. So better to avoid succinylcholine in post-burns patients. Pediatrics. So in pediatrics, the patient may go for sudden bradycardia, cardiac arrest. So we should give priorly atropine. Atropinization of the pediatric patients is must before giving succinylcholine to prevent bradyarrhythmias, bradycardia, and cardiac arrest. In unidentified muscular dystrophies, it can cause fatal hyperkalemia. So better to avoid in pediatric population. Then neuromuscular disorders like Guillain-Barré and myasthenia gravis, it's it can cause prolonged blockade. So the receptors will be more sensitive to the depolarizing muscle relaxants like succinylcholine. So better to avoid in patients with neuromuscular disorders like Guillain-Barré and myasthenia gravis. So thank you so much.